So welcome everyone. Thank you so much for joining us today to think about preparing for your CPS conference presentation. I'm Susanna Tallarico. I use she, her pronouns. I'm a pediatrician at the Hospital for Sick Children and the faculty lead for faculty development for the medical school. I used to be a high school math teacher, so I love teaching. I have been thinking about teaching for about 25 years. What makes a good teacher? And I have to say, I have never been so nervous for a presentation because this is a presentation about giving a good presentation. And there's a lot that can go wrong. So I really welcome your feedback as we go. And at the end, I'm going to kind of show you the backstage of things that I've done, and you're going to tell me how to make things better. I want to acknowledge the land on which the University of Toronto operates and encourage you to reflect on your relationship with the land. Mine is one of gratitude and one of appreciation that there is so much work that we have to do towards achieving reconciliation. I have no traditional disclosures, but I do want to say that we're all learning and might make mistakes. If you hear something that feels inappropriate, that doesn't land right, please give me feedback as we continue to learn and grow together. Over the next hour, we're going to describe some strategies for engaging participants in active learning, including how to ask good questions, to optimize the use of technology like polling software. I had to learn how to use the polling software, Poll Everywhere, last night. It was a productive struggle, and I hope that it goes well. I usually say that there will be technical difficulties so that when they happen, I can say I promised and delivered my promise. We're also going to spend some time sharing challenges, strategies, and successes with each other and an opportunity to ask any questions. So let's see if the productive struggle works. Where was your first conference? Where was your first CPS conference? Well, I tell you the story of mine. So 2008, we traveled to Victoria with my residency colleagues. 5 of us shared a room, some of us on the floor. And I went to the Empress in Victoria, and there was a mountain of bagels and smoked salmon. And Wendy is still saying, I don't know that you're remembering that correctly because we can't afford bagels and smoked salmon, but I swear bagels and smoked salmon. And there was a presenter called Louis the First, and he talked about giving an excellent presentation. And I still remember that. So if this is your first conference, I want you to type the word first. And that's so exciting. Otherwise, tell me where your first conference was. And maybe somebody can share why it was so memorable. And feel free to unmute yourself and speak right up. Or just type it in the chat. So many first timers. This is so exciting. Lots of people in Toronto. What was so memorable about Toronto? And it's okay to say the shopping. Okay. And what I'm trying to do is create opportunities for groups. So it seems like most people had an exciting experience in Toronto. And so I'm asking, what was so memorable about Toronto to try to encourage people to share of their experience. So that's one of my tips, is to create opportunities for groups to participate when you're in a large group. So feel free to tell me in the chat what was so memorable about Toronto as we move on. And I'm glad that the word first appears big there, because what are we going to do to make our presentation as memorable as Louis the First, so that 20 years later, people say, I went to the CPS, there was this presentation, and I still remember. What I really remember from his talk was that the most important parts of teaching are those that are in between the bedside teaching moments. When you're taking off your gowns, when you're moving from room to room, that's your opportunity to really teach. That was my take home. So we're going to start with a case. April showers bring May flowers. Today's May the 1st, and it's time to start thinking about your CPS conference presentation. You hear that this is going to be the best one yet and want to fit the theme. So we have over 750 registrants, which is great for this time of the year. So you sign up for a webinar with the opportunity to discuss with so many colleagues what makes a presentation the best. And one of the things I love the most about the CPS conference is our colleagues become like family when you see them over and over again. So you're here with family. Let's play the feud. Let's play the family feud and tell me, what are the 10 tips to the best presentation? You can either unmute yourself or put it in the chat. What tips do you have to creating the best presentation or a really good presentation? Any ideas? And you can go ahead and somebody just get us started. One of the things I like to do as a teacher is to make everything sound right. And so watch me do that. So cool video clips. Yes, cool video clips are definitely part of it. You want to use multimedia whenever appropriate. And I'm going to include that under change things up, right? You might want to have some didactic transmission of knowledge. You might want to have some polls. You might want to have some videos. Every 10 or 15 minutes, you have to change things up. We also have clear structure. You want to have, I'm going to put that under effective slides. So effective slides should tell a story, a very clear story, starting with a case and going from an familiar to an unfamiliar content. So start with something that participants are familiar with, that they know, and then build on that. So clear structure with effective slides. And you definitely want to have interactivity. So there's a few actually different tips for interactivity. So how might we create interactivity? Somebody says have icebreakers, and I'm going to put that under set the stage. So when you set the stage, you want to build community. And we tried to do that with the little icebreaker. Just, think about when your first CPS conference was. Let's get some memories going. So definitely icebreakers. Know to your audience and what they need to learn. So a little bit of a needs assessment, right? And we do that by asking questions. You want to ask questions at the beginning. Maybe when you set the stage, you set expectations. This is what my objectives are. What are the gaps? What else would you like me to address here? So let's just add to that piece on interaction. Any thoughts on how we might incorporate some interactivity? Bring them into the discussion, definitely. And so you can bring them into this discussion by asking good questions, and I'm going to give you some strategies for that. You can grab people's attentions and really draw them in by bringing a case or telling a story. You can also use polling software to ask questions or play games like this one. You can also summarize and pause for questions. Say, I'll take some questions. One of my strategies to make sure that we don't go off track and end up with no time is to say, if you're confused, I want you to interrupt me and ask your question. If you're curious, park it and we'll answer curious questions at the end or even afterwards. And that seems to work really well so that we don't get derailed, because there's a lot of curiosity and that's good, but not during the session. We want to get people to the lunchtime buffet on time. Okay. One of the most important tips is to be enthusiastic. I learned this when I was learning how to teach online. We're all very enthusiastic about our topics. Make sure that you communicate that. Don't forget that even though we're teaching adult learners, the learning environment is very important. And I'm going to speak to how to optimize the learning environment through cultural humility, psychological safety, and inclusivity. And finally, less is more. The biggest pitfall is putting in too much and not leaving enough time for questions. So keeping it simple and moving on. So when you set the stage, notice how I introduced myself and my pronouns. By doing that, you're signaling that I'm aware that language matters and that I'm trying to create a safer space, an accountable space, and that I'm mindful of that. By sharing my pronouns, I'm inviting others to share theirs without putting them on the spot to do so. You want to disclose conflicts of interest, if any. Build community through a quick icebreaker. So you could use online polling software. You could just say, Who in the room is a pediatrician? Who in the room is a Maple Leafs fan? That sort of a thing. Include clear objectives. The objectives are the roadmap to your presentation. Remember that we have to have a verb at the beginning of an objective. We're probably going to be focusing mainly on the kind of lower areas of Bloom's taxonomy. So remembering things, so listing, lots of understanding, hopefully. So describe, discuss, identify, some application. We're going to use, we're going to demonstrate, we're going to interpret, some analysis. So compare, contrast. So even if you've already submitted your objectives, make sure that you brush them up so that there's a verb and it's very clear. If I had to measure what my participants are learning, how do I measure that? We don't start with understand, because how do we know that somebody understood something? You would say describe or list. Okay. And then go right into a story, just like we did. You signed up for this webinar. It's all about you. Select a case that's inclusive and resonates with the participants and reflects participant and patient identities and cultural diversity. This doesn't mean just including a name that might be culturally diverse, really bringing in different experiences, different components, different ways of thinking, different ways of seeing. Use a multi-part case and go back to it at times. Keep revisiting the case. Always think about the questions that you would ask ahead of time. And also think about the questions that you might get ahead of time and build them into your talk, the questions that you'll ask about the case. You're ready to start? Develop a storyboard for yourself. Think about, what are my PowerPoint slides going to look like in the end? What might be a logical flow considering the topic and my goals and objectives from beginning to end? And the first thing we typically do is create slides. So I'm going to give you some tips on using effective slides. You don't have to. There's nothing wrong with the old chalk and talk from my math classroom. If that's how you decide that you want to teach, totally okay. So this is a bad slide. Can you tell me what's good or bad about it? Again, feel free to unmute yourself, raise your hand, type in the chat. Few things. Can't read it. That's not a good thing. Too many words. Too busy. Too much information. No pictures. All right, all good thoughts. And I agree with all of them. So definitely too many words. I'm going to teach you about the rule of 6. What do you think about the colors? Too many?
They're just difficult to see.
They're difficult
And
to see because, yeah,
they're very similar as well. Like blue and yellow equals green. So that is not a good combination.
Yeah, there's not a lot of contrast. You're allowed to use up to 4 colors on a slide, but you really want to use the contrast to emphasize your points. And so we can critique this. So here we go. You want to select a standard sans serif font. I learned about this through this article, but serif fonts like Times New Roman that have different thickness of lines are actually difficult to read. So you want to select a sans serif font like Arial, Calibrial, Helvetica that are all the same size. They're actually easier to read, and you want to have a maximum of 2, one for the heading and one for the body, or use the same one for both. Think about the size of your room. If you're doing a large plenary, 42 points for the heading, 36 for the text. If you have a smaller room, you can go a bit smaller, but I wouldn't. So I've chosen for this presentation, 42 for the headings and 36 for all of the main text. Choose mostly lowercase letters. You'll often see all caps, but the eye recognizes letters by looking at the upper half, which is easier in lowercase letters. The rule of 6, only one idea per screen, 6 lines up and down, and 6 words per line. So that slide that we saw had way more than that. We can use color to highlight key messages. Maybe you want to provide learning cues. You'll notice that I'm using a painting every time we switch from one topic to another. I have a painting with a title by my favorite artist, Katerina Martikis, who's Ottawa-based. You can use color to emphasize relationships or discriminate between topics or objects. a maximum of 4 per slide, and be consistent. Use the same ones. Think about the meaning of the color. So maybe red means stop and green means go. And again, it should complement the background. So black or blue against a white background, for example. But be careful. Even this blue here is a little bit light. This purple is a little bit light. The black, although boring, provides more contrast. This blue in the title provides more contrast. There's the picture superiority effect. So pictures are remembered better than words. So think about, what can I replace by an image? Remember that images need to enhance the message and not provide a distraction. So don't just add images because, and don't ever layer. Don't put words on top of images. I've seen that. Remember that faces can be used to grab somebody's attention. So use that to your advantage if you want to bring people back. Think about signal to noise. So what's the information and what is not essential? And if you can remove it, remove it. If it can be minimized, like for example, lines on a grid, can you make them lighter? The footer, can you make it smaller? Remember that it's okay to have empty space. It gives the elements that are on the slide their power to really stand out. And, you know, these are the technical components, but what really makes messages stick? So we know, we've heard a lot of stories. Emotions, pictures, vivid images, videos, as we heard, tell stories. A great presentation from beginning to end tells a story. So you're going to tell a patient story, right? Some people say don't call them cases, call them patient stories, but your whole presentation is going to tell a story. Stick to the point, keep it simple. Give real examples, of course, maintaining confidentiality. Support your claims with references whenever possible. And surprise people. Ask questions that expose gaps. The theory of transformative learning says that we learn the most when we're confronted by a disorienting dilemma, something that makes us question what we thought we knew, or realize that we didn't know something. So ask good questions. So your goal is to help participants achieve an understanding and long-term learning. Which one of the following is the most effective strategies to do that, to achieve an understanding and long-term learning? Use Poll Everywhere to tell me, is it didactic teaching? Is it productive struggle? Is it shame-based learning? Or is it self-directed learning? Again, didactic teaching, productive struggle, shame-based learning, or self-directed learning, which is the best to help participants achieve an understanding and long-term learning, not just short-term knowledge acquisition, real understanding and long-term learning. Okay, so please take a minute to answer the question. We'll wait for a few more. And I see some people are answering the chat, and that's totally okay. Thank you. We see the dial moving. And Poll Everywhere is the software that you can use. CPS has an account. It took me a little bit to figure it out. It was a bit of a productive struggle yesterday. As I learned how to embed it into PowerPoint, I learned I had to update my operating system, but it is a nice way to engage a large group. There's no limit to how many participants you can have, and it allows you to do things like multiple choice questions, word clouds, and various different interactive strategies. So let's take a look at our answers. We have some people that say didactic teaching, and didactic teaching is the transmission of knowledge, and I'm doing some of that today. So you want to do some of that, but it's actually not the most effective strategy to really help people understand and remember. We have evidence that productive struggle, coming from the theory of adaptive expertise, is actually more effective. And I'm going to talk a lot about that. I'm glad that nobody picked shame-based learning, and some people did pick self-directed learning. Self-directed learning is incorporated in that idea of productive struggle because it involves guided discovery. It involves asking questions and having people problem solve and then consolidating that knowledge. So let me give you an example. So you want to ask good questions and support productive struggle to really help people understand and then remember. How do we do this? So there's two very practical strategies. So you want to encourage participants to make connections between basic science and clinical situations. And when I say basic science, I don't mean basic anatomy science. It can be social sciences, it can be psychological sciences, it can be political sciences, by asking why. So here's an example. A 2-month-old baby presents with significant non-bilious projectile vomiting. The labs show a hypokalemic, hyperchloremic metabolic alkalosis. Why? What's the connection between vomiting and this gas? We're going to dig deep here. You have to thank my friend Hosanna for coming up with this example, because we use this when we taught the medical students. What is the connection between vomiting and this gas? Remember, I'm going to make everything sound right. So unmute yourselves, put it in the chat. Give me something to get us started. Give you a clue. What happens when you actually vomit? What are you vomiting? Stomach acid, gastric contents. Yeah, you're puking protons. So when you're puking protons, you're losing that acid. And which organs get a little bit excited? You also, yeah, you're losing hydrogen ions. Which organ gets excited when you get dehydrated or maybe like a little upset? The kidneys. And so the kidneys get involved. Thank you for answering in the chat. And do you remember which system gets activated when the kidneys get upset? What system they turn on? This one's a little bit harder to remember. So we're going to go the RAS system. Jessie remembers. Jessie's a gastroenterologist. Good for you, Jessie. So you want to allow for a period of struggle and sometimes failure. Sometimes you need to get the wrong answer, but the wrong answer is good. It helps us get to the right answer and it helps us remember. This is how we prioritize long-term learning over short-term performance or knowledge acquisition. It is very important, though, after a period of struggle, to provide immediate direct instruction or feedback to consolidate that learning. This is the difference between self-directed learning and productive struggle. So here it is. This is what you told me. When you vomit, you lose gastric juice, so you're losing protons. You're also losing chloride. So that's how you get the hypochloremia. You're losing protons. That's how you get the metabolic alkalosis. You're dehydrated. The kidney gets excited, maybe a little upset. That RAS system is activated. Marisha as well gave me the RAS system. And that turns on, your angiotensin, your aldosterone. You get more bicarb reabsorption, more proton secreted, contributes to your metabolic alkalosis, and you get potassium secretion as well, which contributes to your hypokalemia. Did you know that you had it in you to construct that together? And you're never going to forget that because we just did it together. We struggled a little bit, but we made a connection between that basic science and that clinical presentation. And you can use this for a lot of things by just asking why or how. The other thing you want to do is you want to provide meaningful variation. So you want to ask, what if? What if instead of being 2 months old, this baby was 2 years old? Then what? Should we be thinking about pyloric stenosis? I see some people shaking their heads who have their cameras on. No, because they're too old. What if there was bruising? This 2-month-old with vomiting has bruising. Then what? The 2-month-old, we have to think about non-accidental injury, right? So we have to call our colleagues in Scannon at the CAS. Thank you. And you also want to provide examples that represent the various way the conditions might present. So when I have 2 patients with bronchiolitis on the ward, I say one is looking like this on high flow, the other one is looking like this. In this case, you could say this patient is presenting with non-bilious vomiting, but pyloric stenosis can also present with bilious and non-projectile vomiting. Okay, so that is the theory of adaptive expertise and productive struggle. I'm going to pause for a second there in case there's any questions, because we're about halfway through. Any questions so far? Especially confused questions. Curious, we'll leave till the end. Thank you, Michelle, for the feedback. Okay, and really you can ask any question as long as the answer lands safely, right? One of the reasons I was most nervous about this is I don't know some of you. What makes teaching so great is when you have a nice relationship with people and they know that their answer is going to land safely with me. And so what do we do to make sure that we can optimize the learning environment so that people feel comfortable participating? You want to create psychological safety. So psychological safety is creating a space where everyone feels comfortable asking questions, taking risks, making mistakes, and asking for help. It's one where they feel respected, that their efforts and their skills are valued, that they feel like they can give you the wrong answer. You're going to make it feel half right. You're going to make it sound half right. Notice how this is different than saying I'm creating a totally safe space. No such thing as a totally safe space. We don't have control over what people say. We don't have control over what people find triggering, but we can try to achieve psychological safety where people feel comfortable asking for help. I'm not sure, I'm confused. And there's 3 ways of doing this. One is setting expectations. One is inviting participation. And the other is destigmatizing failure. I like the wrong answer. It helps us get to the right answer. And there's a question in the chat, what size of group can we ask such questions? Is there a limit? And I'm going to say no. There is no limit to how big your group can be. The bigger, the better. You might get somebody to give you the right answer, but you might have to think about how you're going to receive that answer. So you might want to use polling software if it's a super big group, because people might feel intimidated participating in a super big group. But I would say there's no limit to how many questions you want to ask and the size of the group. Again, I'm going to revisit that idea of using inclusive language. I gave you the example of sharing your pronouns because it invites others to share theirs. We never want to say what is your preferred pronoun because that implies that gender is a preference. And we could spend a whole hour just talking about inclusive language because language really matters. Language can be used to include people, to uplift people. It also has been used to dismiss, to exclude people. And so have someone take a look at your presentation. Take a look at a language guide. There's many of them. Is this inclusive language? Right there, and there's some debate, right? Is this the appropriate term or is this the appropriate term for some terms? And there are some terms that there are clearly offensive words. For example, we would never use the term colored skin. I have heard it at large conferences because it has roots in segregation. It is offensive. Okay, Marissa Joseph will say you can use the term deeper skin tones, richer skin tones, black skin, brown skin, but we don't say colored skin. And if you're not sure, ask a colleague, consult a guide, email me. I've done a lot of thinking about this. And we'll also talk about what to do if you hear, again, something that feels inappropriate. You might want to set the stage in cultural humility and acknowledge yourself as a learner and say, I'm here as an ally. I'm here as a learner. I'm learning. I might make a mistake. If you hear something, please give me feedback. Our Department of Medicine at U of T came out with some guidelines for inclusivity that I find very practical. So some do's and don'ts. So don't assume that an identity group being discussed is not represented in the room. Don't assume that somebody is willing to speak on behalf of a group that they may or may not represent. Don't lock eyes with someone and put them on the spot to answer a question or to teach based on their lived experience. It's different if somebody wants to share their experience, but we don't expect anyone to teach others based on their lived experience. So keep this in mind. Our language is very important. Our nonverbal language is just as important. This is Loretta G. Ross, and she talks about calling in versus calling out, how we might go about if we hear something inappropriate, right? There's some situations where language is clearly offensive, racist, and that's the intention, and we need to call it out and we need to shut it down. And then there's opportunities where we could call people in. And we can respond with humility. We can say, I recently learned that it's inappropriate to say you guys, because by saying you guys, we are excluding anyone who is not a man, cis, or trans. It's more inclusive to say friends, folks, you all. And that's something I actually learned 20 years ago, was feedback given to me, but you could say, I recently learned that that's inappropriate. And I want to share that with you because now I really listen for it. So back to our case, back to your CPS presentation, which is why you're here. And we have enough time to quickly break out just so that you can chat for about 5 minutes. And before we break out, I want to ask for any questions. I have to remind myself to do that. I like to keep going. Any questions before we break out?
Just, it might be too early to talk about it, but the Pull In Everywhere software is only for the plenary sessions, and the free software is only available for groups of 25 or less. So do you have any suggestions? Because it is very expensive to purchase.
Yes. So the CPS has an account that they're willing to share with us. I'm using the CPS account right now. So they have a login.
Okay, but it says in the instructions that it's only for plenary sessions.
Yeah. Is that true, Emily, that it's only for plenaries?
Hi,
Emily?
yes, it is. Um, we've got a second account, so I'll look into that.
Yeah.
And an email's going out with the recording of the session, so I will be sure to answer that question in that email.
Yeah. So the other thing is you can also go low tech, right? There's nothing wrong with raising your hand. Um, I've actually sometimes brought out little cards with A, B, C, D, right? The point is to ask the good questions. In a smaller group, you can get away with raising your hand. In a plenary, you might want to do the poll so that you get some feedback as well. Jesse.
Yeah, I also had a question about the polling because we recently did it at a conference, but it was very challenging to have get it on our computers because of the security. So I had to actually do it in the speaker ready room with some tech there. But I heard you got a way around it. So I guess it's IT I have to call because otherwise you can't really download it. There's no interface with PowerPoint. So that was very challenging.
Yes, you're right. So with Max, there is no interface with PowerPoint, but I was able to insert it as an add-in and then just have it open on another device to activate it.
Yeah.
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 So there are
Okay.
ways around it. There's a good question in the chat about copyright. We do have to be careful of copyright whenever you take anything from the internet. So I'm using Katarina Martikas's images with her name signed on all of them. I have never had issues with that. I use them all of the time. I did once use a song from Taylor Swift. I played a song from Taylor Swift in one of my webinars and it was posted on the internet. And Taylor Swift's people contacted the Office of Faculty Development to tell us to take it down. So you do have to be very aware of copyright issues. Any academic presentation needs to be referenced, but keep that in mind. Okay. Any questions on my content? Gina, go ahead.
Is it enough to give credit to the source, the picture source, for CPS purposes? It isn't for every conference, but
I think it depends. I think it depends on the image and what the copyright is on it. I think it depends. I don't think we can take any image and use it without being conscious of that. Yeah, I think it depends. Okay, let's do the breakout. So back to our case, which is all about you, your CPS presentation. I want you to reflect on what you just learned and think about, did anything surprise you and why? Did you learn something new that surprised you? Because that's usually when we learn the most, when something challenges what we think is the way things should be. And how will you change your presentation because of it? Either the thing that surprised you or just something else that you learned. And think about this in different contexts. So think about your context. If you're giving a plenary, maybe you're giving a hybrid session. We have a lot of hybrid sessions this year where they're going to be recorded. And so you have a live audience at home and it's going to be available for people to watch after the fact. Maybe you're giving a workshop where the expectation is to have more interactivity. Maybe you're giving a lunchtime symposia, or you're doing the Ask Me Anything session, which is the smaller groups without slides. How are you going to change your presentation because of what you just learned? So we're going to take 5 minutes. Emily's going to open the breakout rooms in groups of 3. And if you haven't started thinking about your presentation, now is the time. Please accept our invitation and please come back. And as our numbers start going up and the rooms force a close, anyone want to share reflections, thoughts on their presentation, how they might incorporate some of what they just learned, or even anything we left out that I left out? I obviously haven't covered all of the strategies. Marisha, go ahead.
So I like the rule of 6. I am often someone who feels I have so much to say about cardiology. I just trying to give you all that's in my head. So I will certainly be implementing that and making my slides simpler. The one thing, because it's going to be kind of ECG based and maybe some simpler common cases that can actually be confounding, poll everywhere would be very, very helpful. And I'm in a workshop setting, which doesn't seem to have that option. And I imagine it's going to be relatively large, and I do know it can be intimidating.
So I was just clarifying with Emily, because I met with Wendy and Rita yesterday, and it sounds like we can use the poll everywhere for smaller sessions, not just the huge plenaries. The only thing is we
Okay.
can't use it we can't use it for concurrent sessions. So if you're interested in using poll everywhere, email Emily today so that we could say, okay, cardiology is going to use the poll everywhere during this time, and it'll be used for them. And I think we might even have a second account. Emily's going to look into it, but I want to encourage the use of the poll everywhere. And so if you do want to use it, email Emily. If I could figure it out, I am not that tech savvy. Anyone can figure it out. But yes, that's a hot section every year. The ECGs, and for the ECGs, you know, that's a good one where you can consider the familiar to unfamiliar progression. Start with something more simple and work up to the more challenging.
Absolutely. That's the plan.
Thank you, Marisha. Any other reflections? Or even just what surprised you from what you just heard?
And for me, it's the language as well.
Yeah.
Being very cognizant of how we say things, even though we say it and very casually and we mean nothing by it. Like saying guys, I know it's just something that you say quite commonly, and it's actually made me think about other things and as you talked about it. So I'm definitely going to go to look at some of those language strategies
There's
to
so
educate
much.
myself.
I remember when I was in teachers college, we're talking 25 years ago, my host teacher said to me, don't use the term you guys. And I thought, was it because I'm being colloquial, right? Like I'm just being too friendly. And then when I looked into it, it's because it is not inclusive. And ever since then, I just remember I remember hearing you guys all the time, right? It's the VU of the English language. But when you're aware of it, you'll listen for it, and we will use it less to be more inclusive. And again, if you're not sure, reach out. Lots of language guides. Ask a colleague, and start by setting the stage in cultural humility. I'm learning, and I want your feedback. Child first language. So yes, person first language, patient first language, right? Person with, patient with.
And that goes for children who are typically developing as well, right? Like we don't say typically developing child and the next sentence we say child with disability, because then we're singling them out, right? So I
Yes.
think in disability language, that is really important. And in disability language, also using what the child has in not in eponymous terms, but in actual terms, like trisomy 21, not Down syndrome.
And some people would say to use Down syndrome and not trisomy 21. I know some of my colleagues will say that, and this is one of this is one of the things with language. Some terms are debated, but it's okay. Open that floor, right? Have those dialogues.
What are we doing about land acknowledgement? Are we doing, everybody does a land acknowledgement at the beginning of their talk, or are they going to be in terms of sessions at the beginning of a session?
Yeah, good question. I put it in so that hopefully somebody would bring it up, or we could bring it up. You don't have to include a land acknowledgement, right? We will have one at the beginning of the conference. Do what is authentic to you. You can if you want to. What we don't want to do is have everyone included and it seem tokenistic, right? So I've gotten, I want to genuinely encourage people to reflect on their relationship with this land. And so I don't read them, I acknowledge it. And I want people to truly reflect on our relationships and what we need to do to achieve reconciliation. So up to you how you want to incorporate it, how you want to speak to it, but be authentic about it. Michelle.
Susanna, I just wanted to thank you for this meeting today. It's very helpful. And I think one of the takeaways for me is your suggestion about, asking these questions in a very safe way, right? I think it's, we all bring to these learning environments our own history of education and fear of failure and so on. But I really liked how you suggested changing the question to what if, and you changed the details of your patient's story to just sort of bring in some new learning from that different angle. So I really appreciated that. Thank you.
Yeah, the what if is the best tool out there. So Dr. Mosier and I, who was on the call, did a session a few years ago on mental health. We were kind of the pediatrician psychiatry duo. We presented a case. The patient goes on an SSRI. What if the patient develops suicidal ideation? What if this happens? You can have one case and what if it for an hour. I think it's the best strategy.
That's fantastic. Thank you for that.
Comment in the chat. Some communities do prefer identity first language. Yes, the deaf community, the autistic community. CPS logos for the slides. You don't have to use a CPS logo. There's no slide deck that we're forcing you to use. You can use your own slides because it would be hard to standardize them across over 100 speakers. So your own slides. You notice I don't have any logos or backgrounds. Remember that the pictures have to add to your message and not distract from your message. Okay, we will continue to take questions, but I want to make sure I have time for my take-home tips and model that take-home tips are very important. I am Italian, and when you go to an Italian wedding or any event, you get a bomboniera, which is a gift that you get to take home, and it's wrapped up and it's got these candy-covered almonds in it. And you must think, what are my participants taking home? They get very upset if they don't get a bomboniera. So make sure that you are enthusiastic, and enthusiasm isn't enough. Be prepared. Practice, put the effort into your slides. Think about your questions. Think about what the questions you might get asked are and be prepared to answer them. Set the stage. Start by introducing yourself. Consider including your pronouns and build communities through some sort of an icebreaker, even if it's just hands up, hands down. Don't forget any conflicts of interest. Clear objectives with verbs that tell you, what have we done? So, did we describe interactive strategies today? I hope so. Did I show you how to use Poll Everywhere? I think so. Do we have an opportunity to share challenges, strategies, and successes? Yes, and there will be more. Introduce the topic with a case or a story. Stories are an amazing way to evoke emotions. And then what if it throughout. Use your slides effectively. Keep them simple with those strategies that we talked about today. Incorporate active learning throughout. The most important strategy is to ask good questions that make people really think and make connections between basic and clinical sciences that challenge their assumptions. Use polling software or games so that you also get a sense of misconceptions and make it a little bit more interesting. Lots of Jeopardy, Family Feud templates on the internet. Don't forget to pause for questions. I had to put the artwork to remind me to do that. And maybe prioritize confused over curious questions to keep things going and everyone engaged. Consider having breakout rooms like we did today. You can just turn to the person beside you. The biggest challenge is bringing people back. So I just say welcome back instead of clapping my hands, turning off the lights, all sorts of strategies I've seen. Welcome back, everyone, into the microphone. Don't forget to optimize the learning environment by positioning yourself as a learner in cultural humility, remembering the importance of psychological safety. So people should feel comfortable making mistakes, asking questions, and asking for help. Use inclusive language, use inclusive cases, inclusive images to create inclusivity. Change things up every 10 to 15 minutes. So you start didactic and then you bring in a question and then you have a breakout room and then you bring in a video because our attention only lasts so long. And by shifting gears, you're going to keep people listening. Less is more. The flipped classroom approach means you can give people homework. So use the in-class time to interact with material, but anything that they can learn on their own, give them a handout. So for example, sometimes when I teach about effective presentations, I might give a handout on the slides component. And we can use the time we have together to talk about some of the more complex issues. Always leave enough time for questions at the end. You don't want to seem rushed. You don't want to be flipping through slides. Use assessment for learning. So how do you know that participants have learned what you expect them to if you don't ask them questions throughout? If you don't ask them, like we did today, here's what we just learned. Can you apply it to something and then share your reflections with me? So I always tell my learners, I am asking you questions for your learning, not because I'm judging you, because I'm here to support your learning. And that's my bomboniera to you. And I invite you to stay and share challenges, strategies, and successes, or thank you for participating and wish you well with the rest of your day.